From Dr. Lisa Nagy. I am commenting in support of Representative Abrami's legislation, House Bill 1466, regarding the 500-meter, 1,640-foot installation distance for cell towers and transmitters. I have a number of credentials in the area of electromagnetic fields, or EMF exposure and intolerance. I, with Dr. Lynn Patrick, hosted the first ever U.S. medical conference on health effects of EMFs in 2019, standing in for my mentor, Dr. Bill Ray, the late Dr. Bill Ray. My CV will be emailed to you shortly, and you will see that I attended the University of Pennsylvania and Cornell Medical School and am board certified in emergency medicine. I have participated for over 20 years in hundreds of meetings at the CDC, NIH, the EPA, and I offer my talk at the National Institutes of Environmental Health Sciences for you to review, and you will have that link in my email. I educate doctors and the public, including interviews on the Netflix series Afflicted, Dr. Phil, The Doctors, Nightline, and more. I have presented in Congress and helped to raise $100 million for toxic exposure research for veterans who became electrically and chemically sensitive from wartime exposures. I was never taught in medical school about environmental exposures, the chronic effects of chemicals or radiofrequency radiation. I learned it by becoming ill myself and slowly recovering over a 10-year period. I then went on to practice again, and I now advocate for those without a strong voice. I appreciate your efforts to learn more about the wireless radiation issue, although I know it is hard for politicians and the lay public supposedly not affected by environmental exposures that they know of, to realize that these radio frequencies affect us all and all of the cells of our body at the level of the voltage-gated calcium channel. Although we might not be aware that our phone heating up in our hand or heating our ear is evidence of sensitivity to our already sick cells, decreased blood flow to the brain is clearly proven to be slowed by cell phones on a PET scanning study published a decade ago in the Journal of Cerebral Blood Flow. I will skip over a little bit of this, but I do want to say that in December 2021, the Massachusetts Medical Society adopted a wireless communications public safety standards policy statement such that appropriate agencies must research the health effects of radiofrequency radiation and, based on their findings, adjust exposure guidelines. So the wheels of acceptance of the danger of electromagnetic fields are turning, and it is thought that this particular distance of 1,640 feet is a reasonable guideline to start with, although the very sensitive will still need to be further away from these kinds of transmitters. We must train doctors, first responders, and emergency room personnel that these conditions are real. The patients are not mentally ill, and respect their demands to avoid exposure to anything in the environment, in the ambulances, in the ER, or in the hospitals that make them acutely ill.
Please start to sum up, please.
Okay. Professional training is available through the EMF Medical Conference, and in your packet you will see a letter from the director of the conference, Libby Kelly. So please, it is important for citizens to be able to register harmful exposures in the database you propose so we can quantify the harm epidemiologically and further establish informed public health policy. And she welcomes you to reach out to Dr. Nagy directly. Thank you.
Thank you very much. Do I see any questions from our committee members? Seeing none, thank you so much. Oh, where?
Rep. Bernardi.
Sorry. Representative Bernardi is recognized for a question.
Thank you, Chairman. Thank you, Doctor. So the Mass Medical Society adopted this safety standard policy statement. Has there been any work that has come from that about setting standards?
No, that was just adopted in December, but in your email you will find a full resolution and be able to see what they base their recommendations on.